Recently, I saw a patient in clinic with polycystic ovary syndrome. It is an imbalance or affecting women during their reproductive age, and it is prevalent with 5 to 10% of women of reproductive age globally. Health implications are diabetes and cardiovascular and endometrial cancer. So it's important that we catch it. So some of those risk factors that we can look over at the health history or family history for a patient that may be presenting is their family history may have it does have a genetic component. Also, there's some insulin resistance and imbalances with the hormonal imbalances. Also, about 50% of the women are obese or overweight. In lifestyles, usually they have a poor diet and sedentary lifestyle. So, some of the things that I noticed that all the vital signs were normal. I looked over the medications to see if there was anything that would cause androgen producing meds. And also I wanted to ask about irregular periods, if there was infrequent, and this particular patient had amenorrhea, which was absent of the periods, and then when she did have periods, she complained that she had irregular periods. Then on physical examination, I did note some of the hallmark signs of PCOS, presenting symptoms like hirsutism, which is that excess growth all over the body, acne, some thinning or male pattern baldness, and also there's some dark patches along the skin, the acanthosis around the neck. And so those are some of the things that you can see in a physical assessment. So what we manage is some of the diagnostics. Now, typically that patient can meet diagnostic criteria by just your physical exam and medical history, but you can go in and do ultrasounds or order testosterone levels and things like that to kind of get a clearer picture of it, but it's not really necessary to be able to, but there is that room to be able to do the transvaginal ultrasound if need be. So medications, you usually want to do metformin to get that insulin index, glycemic index under control, trying to regulate those menstrual cycles with some contraceptive. Usually it's got some both a little estrogen and a little bit of progesterone, and also you can do spironolactone, which decreases the testosterone as well. There are other things that you can do for facial creams and things like that. You want to work on lifestyle, getting them to eat better, get some their weight under control, make sure they're following up, and if there's any issues with fertility, then you definitely want to get a counselor involved to help with those issues, and also some support on this. So thank you for watching my presentation.